Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. The topic is physiological integrity. A patient presents to the emergency department with a complaint of watery diarrhea for the past 3 days. Assessment findings include blood pressure 160, pulse 98, and dry mucous membranes. The healthcare provider would anticipate intravenous therapy administration with which of the following fluids? Option A. Hypotonic crystalloid. Option B. Isotonic crystalloid. Option C. Hypertonic crystalloid. Option D. Colloid solution. Right answer is Option B. Isotonic crystalloid. Hypovolemia is corrected by expanding the intravascular compartment. An isotonic IV solution will expand the intravascular compartment without affecting cells and tissues of other fluid compartments. Hypertonic and colloid solutions would pull fluid into the intravascular space, but at the expense of other fluid compartments. The healthcare provider is planning care for 4 patients. Which patient is most in need of interventions aimed at preventing anemia? The patient. Option A. With renal failure on hemodialysis. Option B. Who is a vegetarian. Option C. With a Jackson-Pratt drain. Option D. Who has been NPO for 3 days. Right answer is Option A. With renal failure on hemodialysis. Because of decreased production of erythropoietin, renal failure causes fewer red blood cells to be produced by the bone marrow. Also, hemodialysis can cause hemolysis, so this patient is at highest risk for anemia. While a true vegan diet may increase risk for anemia, most vegetarian diets include proper nutrients to prevent anemia. Unless a post-op patient with a Jackson-Pratt drain shows signs of acute hemorrhage, anemia is not likely. For a patient who is in the late stages of chronic bronchitis, which of the following would indicate the patient has developed cor pulmonale? Option A. Venous stasis ulcers. Option B. Night sweats. Option C. Hepatomegaly. Option D. Hypocapnia. Right answer is Option C. Hepatomegaly. Cor pulmonale, or right-sided heart failure, is the result of a lung condition, such as chronic bronchitis or COPD. The diseased lungs deliver less oxygen to the right ventricle, putting a strain on the heart from pulmonary hypertension. Over time, the right ventricle fails, causing increased venous pressure and liver enlargement, hepatomegaly. Common early symptoms include fatigue, tachypnea, shortness of breath on exertion, and a cough. A diabetic patient receives 10 units of regular insulin and 20 units of NPH insulin each day after breakfast. After following normal preparation steps for administering insulin, what should the nurse do next? Option A. Either insulin can be drawn first, as long as 30 units are given. Option B. Draw up regular insulin first, because it is clear. Option C. Draw up NPH insulin first, because it is clear. Option D. Administer each type of insulin separately for accuracy. Right answer is Option B. Draw up regular insulin first, because it is clear. Regular, short-acting, insulin is clear. NPH, intermediate-acting, is cloudy. Giving one injection is more efficient and comfortable for the patient. Remember the mnemonic, RN, regular to NPH. The correct procedure for administering short and long-acting insulin together is 1. Verify orders for insulin types and doses. 2. Wash hands and put on gloves. 3. Roll NPH, cloudy, insulin between palms to mix contents of the vial. Do not shake. 4. Clean tops of vials with alcohol. Prep for 5 to 10 seconds. A patient with a history of atrial fibrillation for 3 days is admitted to the cardiac unit. Besides initiating an anti-dysrhythmia medication, Which order should the nurse anticipate? Option A. Set up for a cardioversion procedure. Option B. Prepare a heparin infusion. Option C. Immediately give atropine by 4 push. Option D. Obtain consent for AV node ablation. Right answer is Option B. Prepare a heparin infusion. Heparin reduces the risk of stroke that results from blood pooling and clotting in the atria. Medication will control rate and rhythm, so atropine is not indicated. Both cardioversion and ablation are treatments when medication has not been effective. When caring for a patient receiving intravenous chemotherapy for cancer, the healthcare provider will plan to administer the prescribed antiemetic to the patient. Option A. Before starting the infusion. Option B. 1 hour after the infusion is complete. Option C. When the patient complains of nausea. Option D. 1/2 hour after the infusion has started. Right answer is Option A. Before starting the infusion. Most chemotherapeutic agents have a high potential for causing nausea and vomiting. Up to 80% of patients experience chemotherapy-induced nausea and vomiting, which occurs when the vomiting center in the brain is stimulated during the chemotherapy infusion. Administering an antiemetic prior to beginning the infusion can prevent or minimize nausea and vomiting. The healthcare provider is reviewing the International Normalized Ratio (INR) results of a patient with a history of embolic stroke. Which of the following indicates a therapeutic value for this patient? Option A. 2.5. Option B. 4.1. Option C. 1.5. Option D. 0.5. Right answer is Option A. 2.5. Therapeutic INR levels are typically preferred to be slightly higher than normal limits. A general rule of thumb is for INR to be between 2.0 and 3.0 in someone who is receiving anticoagulation therapy. The other values would indicate increased risk of embolism, clot, or bleeding. An INR of 0.5 is within the normal range of 1.1 or lower. An INR of 1.5 is not the therapeutic range, and INR of 4.1 would put a patient at risk for hemorrhage. A nursing student on the medical surgical unit reads that a patient has cyanosis. When the student asks the instructor what cyanosis means, the instructor's best response would be Option A. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of polyoxygenated blood. Option B. Cyanosis is the primary indication that the patient has pneumonia. Option C. Cyanosis means the patient has been exposed to cyanide poisoning. Option D. Cyanosis is the blue coloring of skin and mucous membranes in the presence of highly oxygenated blood. Right answer is Option A. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of polyoxygenated blood. Cyanosis means that there is a blue color noted to the skin, mucous membranes, and nail beds, secondary to polyoxygenated blood. When blood is fully oxygenated, it appears bright red. When it lacks oxygen supply, the blood is a dark purple or bluish red. During an acute exacerbation of inflammatory bowel disease, a patient is to receive total parenteral nutrition, TPN, and lipids. Which of these interventions is the priority when caring for this patient? Option A. Monitor the patient's blood glucose per protocol. Option B. Monitor urine-specific gravity every shift. Option C. Change the administration set every 72 hours. Option D. Infuse the solution in a large peripheral vein. Right answer is Option A. Monitor the patient's blood glucose per protocol. TPN can cause hyperglycemia, so blood glucose levels should be closely monitored. Because of the hypertonicity of the TPN solution, it must be administered via a central venous catheter. The high glucose and lipids makes the TPN an excellent medium for bacterial growth, so administration sets should be changed every 24 hours if the TPN contains lipids. When caring for a patient who has a pneumothorax, which of these actions should the healthcare provider include in the patient's plan of care? Option A. Encourage the patient to breathe deeply and cough regularly. Option B. Vigorously massage the tube every 2 hours to promote drainage. Option C. Empty the drainage chamber every shift and record the amount. Option D. Change the insertion site dressing daily using aseptic technique. Right answer is Option A. Encourage the patient to breathe deeply and cough regularly. Regular deep breathing and coughing will help re-expand the collapsed lung. The dressing is changed per protocol or as needed when it becomes soiled. Routine massage, milking, of the chest tube may excessively increase intrapulmonary pressures and may damage the lung. Tracking the amount of drainage each shift is accomplished by marking on the collection chamber. Before receiving a transfusion of whole blood, the laboratory and blood bank require a sample of the patient's blood. Which test will be run? Option A. Blood culture and sensitivity analysis. Option B. Complete blood count, CBC, and differential. Option C. Blood type and cross-match. Option D. Blood type and antigen screen. Right answer is Option C. Blood type and cross-match. A blood type and cross-match is necessary to ensure a match between the blood donor and the patient who is receiving the blood. An incompatible match could result in severe adverse events and possible death. CBC, differential, culture and sensitivity are unnecessary. Blood type and antigen screen is incorrect. The proper test is blood type and antibody screen, which will be performed as part of the cross-match. A patient is prescribed a calcium channel blocker to treat primary hypertension. When teaching the patient about the medication, which of these foods will the healthcare provider advise the patient to avoid? Option A. Eggs. Option B. Grapefruit. Option C. Milk. Option D. Bananas. Right answer is Option B. Grapefruit. Grapefruit and its juice contain furanocoumarins, which block the enzyme cytochrome P450 enzyme CYP3A4, which is involved in metabolizing many drugs, including calcium channel blockers. Medication blood levels can increase, becoming toxic. The levels of calcium channel blockers are increased when grapefruit or grapefruit juice is consumed, potentially causing hypotension. Grapefruit can interfere with other drugs as well, including statins, atorvastatin, lovastatin, simvastatin, and some antibiotics. Which of the following statements by the parent of a pediatric patient indicates further education is needed? Option A. Coughing that won't stop can be a sign of an asthma attack. Option B. My child might become restless if he's having trouble breathing. Option C. I might hear my child wheeze during an asthma attack. Option D. I should expect my child's peak expiratory flow to increase during attack. Right answer is Option D. I should expect my child's peak expiratory flow to increase during attack. Peak expiratory flow rate measures how quickly a patient can exhale. Peak expiratory flow decreases during an asthma exacerbation due to restricted airways. Restlessness is often an early sign of hypoxia, which can occur during an asthma attack. Wheezing is often heard during an acute asthma attack, but is not always present. Early signs of an asthma attack include coughing that doesn't stop, severe wheezing on both inhale and exhale, rapid breathing, neck and chest retractions, difficulty talking. A patient with a diagnosis of Wolff-Parkinson-White syndrome is undergoing a catheter ablation procedure. When caring for the patient after the procedure, which is the priority intervention? Option A. Assess level of consciousness every 20 minutes. Option B. Auscultate apical pulse for a full minute every hour. Option C. Assist the patient to the bathroom to void. Option D. Monitor insertion site and distal pulses. Right answer is Option D. Monitor insertion site and distal pulses. Because the catheter may cause trauma to the vessels, the healthcare provider will monitor for hematoma formation and interference of circulation distal to the insertion site. Bleeding at the site is the most common complication. Assessing level of consciousness is a routine post-op order, so it is not a priority. The extremity where the catheter was inserted will be immobilized initially, so the patient will not be allowed out of bed to use the bathroom. The patient will be on a cardiac monitor. If a drug is 50% protein bound, it means that Option A. 50% less protein should be eaten. Option B. 50% will pass through the intestines. Option C. 50% of the drug destroys protein. Option D. 50% of the drug is available. Right answer is Option D. 50% of the drug is available. The percentage of drug not protein bound is the amount of drug that is free to work as expected. In this case, 50% is unable to be effective because it is protein bound. Protein binding has nothing to do with the destruction of protein, drug excretion, or protein in the diet. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.